Hi, everybody. Welcome to the CoronaSphere Lounge. I'm your host, Bill Whittle, reporting to you from the plane of infinite despair. We have some really good news, interesting news, data, solid looking data from a place that really was not expected. So let me give you a little bit about the background on what we're about to see because it's a pretty good indication, solid indication that social distancing is working, and they've got some pretty impressive dates and data sets and so on. I just realized now I forgot to collect one of the most important ones. Maybe I'll grab it as we go. But in any event, let me just tell you where this data is coming from, then we'll talk about that. I also want to talk about how data is recorded. People are losing confidence in information everywhere. It's 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 just something. Well, it's a different subject. Let's get to the good news first. I suppose I should stress again that the entire reason we're doing this show in the first place was so we could present good news, hopeful news that the media won't report on because they don't want anybody to either think that the problem is less than it should be or over, or also for the political damage, and they've got their agenda, and my agenda is let's spread some good news. So here's the problem in terms of trying to figure out where the trends are, how well social distancing is working, how well all of these interventions are, where the country's going, what's happening, all of it. And we've had a tremendous problem determining the data because we've been looking for COVID-19. We've been looking for tests that test for the virus. But there's a data set that's come in, and I'm going to explain to you my understanding of the limitations of it, but nevertheless, it's interesting, and I think there's a case for it, otherwise I wouldn't have presented it. What if instead of looking for COVID-19, what if you were able to look across the country for the symptoms of COVID-19? One of these symptoms, it's fairly consistent, at least with relatively severe cases, is a fever. So as it turns out, there's a company out there called Kinsa. Kinsa makes smart thermometers. They make thermometers that talk to your cell phone, which normally you may not have heard about or particularly needed, but nevertheless, there it is. And you can elect, I suppose, to have, certainly you don't have to connect your smart thermometer or anything. You don't need a smart thermometer. But nevertheless, there is a thermometer out there called Kinsa. I don't get a check from Kinsa. And it basically is a thermometer, either an oral or however else you may decide to deploy it. And there's also a more expensive one that measures the temperature in your ear. And since I imagine you can elect to do this, that data set gets uploaded, and it's something like 180,000 temperatures recorded every day are uploaded to the Kinsa website. And Kinsa produces a map called healthweather.us. I'll show you some clips from that in a minute. So basically, what I'm saying is that there has been data uploaded for years now that precedes the COVID-19 data. They've been producing this data set, this health weather map, for quite a while. It showed in 1919, end of 1919, you could see this animation of just regular flu coming out. So this information has shown some really remarkable data and trends about COVID-19. So let's take a look at some of these real quick, why don't we? So the first one is this one right here. There's the URL for those of you interested in it. Needless to say, every single one of those counties, you can fly your mouse over, get data for that individual county. If you look in the upper right-hand corner, the selection, the pull-down menu selection is for atypical. So here's what atypical is looking for. It is looking for increases in temperature, in other words, fevers, that are higher than would be expected for where the flu is or should be at this time of year. This is not a map of where COVID-19 has been detected. It is a map, however, where temperatures are running higher than they should be, including for the flu. I'll get to another graph of that in a minute. So this shows you that right now, data is as of yesterday, as we record this on April 4th, data is as of April 3rd, 2020. This shows you that the NAs are essentially not enough data. So the light grays are not enough data. But look at the West Coast there. All of LA County, pretty much from San Diego County, practically up to San Francisco. The whole dark gray box on the left coast there, on the West Coast, happens to be where I live. you'll see that if you look at the color coding bar up atop, it says none. There are no statistically significant increase in fevers in that West Coast block, including what we would expect for flu. In other words, the flu is factored out of this. This is atypical increases in fever. So you can see that Southern California, in fact, almost all of California to the west there, is actually showing not any significant difference than what you would expect for the flu. And this matches pretty well what we're seeing with the actual COVID-19 lab tests and hospitalizations that are coming in, that's saying that California is doing much, much better. And as I said before, I think that's pretty largely due to the fact that we travel in cars. You can see from this also that New Orleans is a hot spot. And at the moment of this, South Florida, Broward, Dade counties are particularly hot. That means that right there, down there now in Florida, the temperatures, not the COVID, I can't stress this enough, but human body temperatures and fevers are significantly higher in Broward and Dade County than you would expect at this time of the year with the flu included. You can certainly also see the hot spot up in the Northeast where New York is and so on. This actually corresponds pretty well. You can see Chicago is pretty much moderate to high. I can't quite make it out. It looks like it's high. So these things actually match what we're seeing in terms of COVID hotspots pretty well. Now that's the news as of today, but here's the really tremendous news. This is really, really good. Here's the next map, and I'll explain what this map is. This is the trend. So in other words, this is looking at the last 7 days. Areas in gray, we'll just start with the gray. Areas in gray means that there is no trend over the last 7 days. There aren't more people running fevers, and there aren't fewer people running fevers. That's the gray. Anything to the right of the gray, if you look at the bar on the top, the orange and the pink, is areas where the trend over the last 7 days has been increasing. In other words, the yellow, orange, and red areas are where people are showing more fevers over the course of the last week. But look at the country. The country is showing blue, and in many cases dark blue. What that means is that over the 7-day period that they've been measuring body temperatures, I cannot stress this enough, this is not a map of COVID-19 infections. Body temperatures, meaning fevers, meaning symptoms of COVID-19, corrected for seasonal flu, virtually the entire country is cooling down. That does not mean that COVID-19 is decreasing, but it does mean that the rate of increase is slowing very, very much in the dark blue areas. It doesn't mean that the cases there are decreasing, but it does mean that the rate of increase is much, much lower. And that's really, really good news. You can still see there's hot spots up in New England and in various parts of the country. Tennessee, I know, has been having some real problems, but there it is. Now, this next chart will really make everything a lot clearer for you. And all of this available at the URL there, healthweather.us. You can fly your cursor over any one of these maps, and you'll get data for that particular map and that particular county. But let me show you why all of this stuff is impressive and what this data actually means. I would have shown you this first, but I thought the maps were more impressive, and this way we can at least get a look at it. We'll go back to the maps one more time. So here's what the data actually shows. This is a map of human temperatures, body temperatures. I will say this every 15 seconds because it is critically important that I'm clear on this point. This is not a graph of COVID-19 infections. It is a graph of body temperatures as observed by the Kinsa smart thermometers. And if you look at the blue dotted line represents what we would expect the nation's body temperature fever rate to be. And you'll notice that from February 15th through May 24th, that line is decreasing, that blue dotted line is decreasing, and that's because flu is a seasonal disease. As it gets warmer and warmer and warmer, the number of flu cases decreases. If you look at the light blue area surrounding that blue dotted line, that's the typical range. In other words, that's more or less the error bars. So take the orange and the red dots out of it. Just imagine it without those for a second. And that blue dotted line would be the expected number of fevers that we would see between February 15th and May 24th. That's seasonal flu decreasing over time as we get into the summer. And the range is the blue shaded area, the light blue, which is more or less the error bars. So anything within the light blue we would consider to still be normal. We would still be considering that to be seasonal flu. And if COVID-19 had not hit the country, what we would expect to see is that every single temperature recording for every single day in terms of fevers would fit inside the blue bars and would be decreasing with temperature. Decreasing with time as things warmed up, as the seasonal flu ebbed. But now take a look at the orange dots. The orange dots are what are observed. This is the actual data coming in from about 180,000 smart thermometers every single day. And you can see, if you start on the left, you can see that it's more or less matching what you would expect for the seasonal flu. And then the atypical point looks like it's starting right around March 1st. And it's still within the blue bars. And if you look at how they've posted this data, it's actually extremely well done. You'll see that even though at the beginning of the blue dotted line, the orange dots are higher than you would expect, they're still inside the blue bar, which means they're still inside the range of possible variations in flu. But when you get to the first of the red dots, every red dot is a temperature. Every red dot represents a collection of nationwide fevers that is higher than what you would expect for seasonal flu. And as you start to get into March, you see those numbers are starting to increase and more red. And the red is not only, the red may look like it's going down, but it's departing. It's higher than the dotted blue line, which would be how we would expect the fevers to be falling with temperature. But look what happens right at the last. Go back from, I don't have the ability to point on this thing, unfortunately. Look at the very right end red dot and then go back one, the peak right there. That's about when social distancing was put in place. Now, according to thermometer readings, small sample data set, but it's nationwide, and 186,000, 168,000, something like that, temperatures a day is not insignificant. You can see that that second to last red dot is about where social distancing was implemented in the United States, and rapidly the reported temperatures fall, and you go a couple of orange dots to the right, and then you see something that I had not expected and is absolutely astonishing. After you see the orange dots fall below the shaded blue area, which is what the entire final third of the graph is, below the, not only below the blue dotted line, below the blue error bars. What that means is that fevers in the country now, people who are running a fever, is significantly lower and gets lower and lower and lower below what you would expect for the flu. So if I read this data correctly, and I probably do, what that's telling us is that this social distancing has not only dramatically cut the number of fevers, but it's cut it way below, well below, something to like 25% of what we would expecting to be seeing just out of the seasonal flu. So we should also see a corresponding decrease in total flu cases as a result of social distancing. That would make sense. Social distancing shouldn't affect just COVID-19. Social distancing should affect anything that's spread by airborne transmission of a corona-like virus. And all this is doing is measuring fevers that are above the norm. And again, just to explain, that dotted blue line with the shaded error bars are what the fever rate is expected to be in the course of a year from February 15th on to May 24th, decreasing as a result of seasonal flu. That's what generally drives fevers. So all this chart is telling us is that it is showing us that the fevers, the number of people with fever spikes started to increase remarkably, dramatically above the norm expected for the flu, and right around the time that we had implemented massive amounts of social distancing, that number fell dramatically. I don't know how many data points there are, but it looks like something like maybe as much as 2 weeks ago or 10 days ago, we actually started to get fewer fevers nationwide, not talking about hotspots, nationwide than we would have expected for the flu, which raises an interesting question. And the question is, it is possible, if I read this data correctly, with all of the caveats in place, I had not thought about this for a second. But it is possible and likely and certainly logical that this social distancing has not only reduced the spread of COVID-19, but the social distancing may have decreased the number of regular flu cases. In fact, may have increased the number of regular flu cases so significantly that if we're going to be measuring lives in this whole thing, it's possible, this I don't have any idea about, this is pure speculation on my part, but certainly if this theory is true, you could say that the additional COVID-19 deaths are mitigated. A life is a life, and I know that's cold comfort to anybody who's lost anybody due to this disease, and I'm not trying to be flip about this in any way. I'm just looking at this from a scientific, gigantic, statistical, political point of view, political, moral, ethical, all of it. But if this is correct, an unexpected consequence of the social distancing would mean that, if we go back to this number again, let's just look at it one more time, would mean that if social distancing has dropped the number of above average temperatures, fevers, below the dotted blue line, which is what we would expect for annual fevers, it's possible that we could be seeing a number of lives saved, not just the COVID-19 lives that would have been lost. We may see a significantly lower number of people who die from the seasonal flu, the flu that kills anywhere from 30 to 40, 50,000 Americans every year. That number could be markedly lower than what it would be if COVID-19 were in here and we hadn't done the social distancing. So if you're going to be doing a balance in terms of lives, it is theoretically possible. I don't want to be saying this because so much is so easy to misunderstand and take out of context. I'm speaking as a person who's just looking at trends without any. I've got no bars on this in terms of numbers, but it is theoretically possible. And in fact, in that case of some of what we're seeing is in fact not only possible, but perhaps even likely, that the social distancing that we put in place to restrict the spread of COVID-19 may conceivably end up saving as many or perhaps even more lives than we would have lost to annual flu if we hadn't done this aggressive move to stop the spread of airborne aerosol-based flu-like viruses. That's a remarkable piece of news. So let's go back one more time, and I want to go back to this one more time and just show you one other thing. Now, two of the data sets that I didn't bring, but are available on this website, weatherhealth.us, shows what is actually happening in terms of dates. And if you'll excuse me for 1 second, I'm just gonna go ahead and grab something here just to give you one example. I'm not going to take a bunch of them, but just to give you one example here. Okay, here's a good one. I'm just going to grab this and pull it in. Come on now. Yes. Okay, so stay with me, folks. Take a look at this. I know I'm doing this on the fly, so excuse me. We'll turn that one off, and we'll turn, yes, I want it to go, and we'll take this one off, and I'll spread this out. Just give me 1 second. I'm kind of doing this on the fly, sorry. Okay, this one's one of many that they've got on the website, but I should have brought this earlier, and I didn't. But here it is. Now, this is looking at the population with flu-like illness. Flu-like illness, in this case, we can take to mean fever. That's what this is measuring. I know I'm sounding like a broken record, but I cannot be too careful here. This is not a track of COVID-19 infections. This is a track of temperatures that are above, this particular chart is a track of temperatures of people with flu-like illness, and since this thermometer is measuring fever, this is measuring people's fever. This is for New York County, New York. You can see that the number is going up when it should be going down, because if it were flu-like viruses only, the flu should be decreasing over time. So you can see that according to this data, we are noticing that, hang on, Let's get my chat room back. There we go. What we're seeing here as we go on 3-1, 3-6, 3-11, the number of people running flu-like temperatures are getting higher, and it should be getting lower as it gets warmer because the flu should be decreasing. We saw that from that earlier chart. So state of emergency declared on March 7th. March 12th, restrictions on public gatherings greater than 500 people. 16th, school closed. 17th, restaurants and bars closed. 20th, the stay-at-order home goes out for New York County, New York. And then the number of flu-like symptoms starts to rapidly decrease. And that is awfully good news. Give me another second. I'll pull another chart for you here. Okay. Just to show you, because I think the more of these I put up here, probably the more compelling this argument gets. Let me bring this one in real quick. I'll just make this a lot faster than last time. You come up here. So again, the value of these graphs is that they have dates applied. So now take a look at this one. So the blue line is Santa Clara County, California, which is doing better than expected. Miami-Dade, Florida, which is showing a hot spot lately, but nevertheless. Look at where the graphs start to change relative to the place where the social interactions were implemented. Now, just for the sake of it, just for a second, defocus your eyes for a little bit, stop looking at the data, and just defocus and look at the blue line with the light blue boxes. The boxes are where political or social events took place. And you can see, if you kind of defocus your eyes a little bit, that Santa Clara County, California, started to put political measures in place considerably ahead of Miami-Dade, Florida. On February 10th, state of emergency declared in Santa Clara. March 5th, work from home guidance. March 9th, restrictions on public gatherings. And Miami-Dade didn't declare a state of emergency until March 12th. March 9th on the blue graph is when restrictions on public gatherings were starting to be put in place, and the number of fevers is going down. Miami-Dade didn't declare emergency till March 12th, and so their line is continuing to go up. March 16th, schools are closed in both counties. You can see that on the blue line, the lines are already going down because Santa Clara had already implemented some closures. But Dade, on March 16th, when schools are closing, the temperatures are still going up. Fevers are increasing. By March 17th, shelter in place is in Santa Clara. March 18th, restaurants and bars are in place in Dade, and the numbers are still going up. Then as you get to about March 20th, 21st, you can see that Dade is starting to follow Santa Clara's trend line because they're starting to put social distancing in place, and Santa Clara puts shelter in place order in 17th, Miami-Dade on the 24th, but by then both lines are going well down, and there are any number of charts like this indicating that the reason I think that, let me go back to that one more time. The reason that I think that this is such a, reason I think that this is such a compelling case, and there are numbers like it on the site, is that it shows a correlation. Correlation is not causality, but in this case, the numbers are starting to look pretty impressive. This shows a pretty distinct correlation between when social distancing measures are put in place and what it does to the trend lines, which are abnormally high fevers with their flu-like symptoms. Okay, so last time to the maps, quick close, and then we're out of here. This is the country as of April 3rd, 2020. This is showing where atypical illnesses. Atypical means, in this case, if you look at the upper left-hand corner, it should be a chart of influenza-like illnesses. And if we had nothing but influenza in the country, the entire country, if there was everybody reporting, should be dark gray, meaning there is no difference, there is no atypical difference from what we would expect with just the flu. Right now, as of April 3rd, this chart, this map of the US is showing areas that have higher than would be expected for the flu numbers of fevers. You can see Miami-Dade's a hot spot, New England and New York is still a hot spot. So this is what's happening now. If you look at the trend for the last 7 days, you will see that with the exception there in the general Tennessee, Kentucky area and up in New England and a little bit of a New York residual there, you can see that the country, now let's be clear in this. This is not saying, obviously it's not saying that temperatures are decreasing because we don't want people's body temperatures lower. What this is saying is that the areas in blue indicate that there are decreasing numbers of people showing fevers. Think of this map as what it is. This is where people in a country are showing fevers. It's got nothing to do with the asymptomatic, or it's got nothing to do with factoring out the flu. This is just a measurement of how fevers in the country are running compared to last week. And you can see that as a general rule, the country is showing fewer fevers, and in large swaths of the country, much fewer fevers. And those much fewer fevers are what we would expect, including influenza. That means that the blue and the dark blue are showing areas where there are fewer people with fevers than we would expect, even if we were because this is looking for influenza-like cases, not abnormal ones. So this is data that's showing that the entire country is actually showing much fewer fevers than we would expect, even with the flu, because if the flu was doing what the flu would normally do in a perfect world of statistical uniformity, the country would be slate gray. It wouldn't be blue, it'd be slate gray. This map is telling me, if I read it correctly, that the country is experiencing significantly fewer high temperatures than would be expected, even lower than what we would expect for the flu. This is really good news. And this to me is news that the social distancing is actually working. Oops, sorry. There, for those of you who can't listen to hear correctly, there it is again with the data. And I think I just get rid of this guy again. And there again, you can see for New York County. And then I'll just bring back one more time because I think this is probably the most important one, and that's this one. Delete this guy. Here you go. So this is the one again. This is the money shot. One more time. I don't mean to hammer this in the ground, but one more time, just for the sake of you may have been coming later, starting to get a handle on what we're seeing here. One more time, the dotted blue line is the temperatures that we should expect to see. The dotted blue line is the number of people, percentage of people of the United States population on the left. You can see from 0 up to about 8% of the population. The dotted blue line is the number of fevers that we would expect to see as a result of regular illnesses like the flu. Decreasing as we get into the summer months. That line will increase if we were to go into the fall and winter of next year because the flu would increase over those months. The orange dots are the observed temperatures recorded by about 160,000, 170,000 Kinsa smart thermometers on a daily basis. All of that information is isolated per county, but it's also averaged into the national county map, which is the United States here. And you can see that for February, the numbers are a little higher, but more or less following what you would expect to see for the flu until you get to the beginning of the dotted line. Then you start to see temperatures increasing. The orange dots mean they're still within the pale blue, which is the error bars, the possible range, not atypical. But then the red dots are where more people are running fevers than you would expect to see for the flu. And you see the dots are getting redder and redder. They're departing further and further from that blue line. And then all of a sudden, social distancing is put into effect. Then the number of fevers starts to come back down to the normal range. It gets into the normal range, and then it crosses the normal range. And for the final third of it, or quarter of it, there are fewer people running fevers in the U.S. than there would be if we had no COVID-19, then let me rephrase that. That was wrong. Forget what I just said. I'm sorry, I was struggling with what I was trying to say. Once that orange line drops below the blue shaded area, which are the error bars, that means that currently, this is real data, people are showing fewer fevers in the United States, including COVID-19, than they would expect to see if COVID-19 wasn't here. That means to me, clearly, that the social distancing is not only cutting the number of people reporting fevers as a symptom of COVID-19, but it is in fact dramatically, at least now it's what? I mean, if I'm looking at this current set, if I go up from the bottom, I go from the last orange dot, the last data set, go up to the dotted blue line, that shows me we should expect to see 3.5% of the population ill with fevers. And that's what we'd expect to see with the flu. According to this, we're seeing maybe 1%, three-quarters of a percent. We're doing better in terms of national fever health than we would be with the flu, and I don't see any possible explanation for this other than the effect of social distancing. A discussion to be had at a later date, and I'm not personally in favor of this, but if this data continues to be true, a discussion could be made, an argument could be made, that if you take the COVID-19 out of this, and we're looking downstream a couple years, aggressive social distancing, which is what we're doing now, could remarkably cut the number of flu deaths per year. And we know this to be true. It's not a mystery. No one's suggesting we trash the economy over that. But it is a pretty compelling piece of data that says that if we start looking at flu differently in the future, and I'm talking about when this thing has stabilized, it's probably never going to go away, but when it's stabilized, we may realize that things like masks for people who think they might have symptoms, self-isolation for people who might, I'm not talking about the government, not talking about society, but this data is showing us what we might be able to do against the flu when this thing is over. And if this flu is taking 40, 50,000, 60,000 American lives a year, what we've learned from COVID-19 may end up to be a net gain in terms of lives that are saved. That's what it looks like to me. Forgive me for calling you out on this again, but a resource is a resource. Did I get that more or less right, do you think, Lord Bias? We have a specialist in epidemiology and infectious diseases who's been watching from the beginning, has been kind enough to be my Jiminy Cricket, sits on my shoulder. I thought I saw him earlier. I don't, without a whole lot of qualifications, I'm sure I got a little wrong around the edges, but that seems to be what this stuff is showing. No response yet, so we must be typing furiously if he's still here. Now, Johnny the Frost here in our live comments stream says that the effects of chloroquine have yet to be seen. Not necessarily. Chloroquine treatments could be included in this because this data set is not measuring COVID-19 in any way. It's not detecting flu viruses. This data set does not measure viral counts or diseases in any way. All it does is take the data from smart thermometers made by, I want to say Kindra. I want to make sure I get this right. Kinsa. Yep. It's taking data from smart thermometers that's being uploaded, and all it's measuring is temperatures, body temperatures, human body temperatures. And looks like nothing but good news to me. I'm going to resist the temptation to talk for another 2 hours about this because the shorter the better. But one final time, just for giggles, I'm not going to go to the big chart. We've seen that all along. According to, by the way, if you are using a smart thermometer, this is how you can get into trouble with statistics and data. Smart thermometers, the Kinsa thermometers, I think the oral thermometer's around $33, and the infrared one that measures inside the ear is about $64. Those are more expensive than normal thermometers. And so obviously on some level, this data is skewed towards higher income people, just from the fact that the temperature sensing mechanisms are expensive. So to some degree, there's obviously that kind of skew in the data. These are expensive thermometers. So you would assume that this data set is coming from people with a little bit more money than average. But the reason that I don't think this is terribly significant is because the virus is not income selective. The virus doesn't care how much money you make. And so even though we are probably recording temperatures from a somewhat, it's not like these thermometers cost $10,000, from a somewhat more affluent sector of the population than the mean, the virus doesn't care about that. So I don't think that is a tremendous impact on the data. In fact, I'm not entirely sure it makes any impact at all, but it needs to be said. So if all this is true, we could be looking better than we thought. There are still people dying by the hundreds as a result of this. And for people who say it's just not happening or it's a hoax, it's just not true. There are people who are losing loved ones who can't even visit them, and so on. And it's real. But fortunately, it seems to be significantly less than what we had thought in our worst case scenarios. Maybe that's because of the worst case scenarios being based on faulty models, possibly. Maybe it's less than expected because social distancing has worked. This is a clear indication to me that it's working because it seems to be working against the flu as well. It could be that they're lower than usual because of the chloroquine having some effect. I don't know. But in any event, this is good news. It's just shockingly good news. And when China is reporting, I'm going to deal with China tomorrow, I think. Best estimates in China now from a number of different sources. China claims to have 3,000 deaths or something like that, based on the number of crematorium urns that are being ordered, and based on what independent sources are able to verify in terms of the number of hours that Chinese crematoriums are working. The best numbers that I said today is that China probably has around 45,000 dead, which is going to be heartbreaking to people like Hillary Clinton and Marcos Molina, who say, hey, we're number one, leading the world in terms of additional deaths. American-hating bastards who are just, number one, using that kind of data for political purposes, and number two, taking China at its word that this country of 1 billion people where the outbreak took place has a total of 3,000 deaths. You've got to really, really hate this country, hate everything about it, to be like Marcos or the Democratic Party nominee for president of the United States, to be basically rubbing Donald Trump's nose in the fact that we've got what they presume to be more deaths than China, which is absolutely ridiculous. And I think all of these people really are going to need a stern social smackdown when it's over. So then the final thing, just very quickly, is this. If all of this information is out there, why isn't it being reported? As I said before, it's a different issue. But I really do think that that the best case you can put on this in terms of the press and the media is that they don't want people to relax social distancing. I think that's strongly mixed with an idea that Americans are just children and we don't have any idea, of what to do or how to handle it. Thank God they're there to make sense out of everything for us. And a significant percentage of the press coverage, especially the entire thing with the hydroxychloroquine, is just plain political meanness that is getting people killed. Governor of Nevada banned hydrochloroquine administered by doctors the day after a couple of rabid Hillary supporters started to drink aquarium cleaner. And now we find out that same governor of Nevada has ordered massive numbers of doses of hydrochloroquine for the Nevada prison system. That guy needs to go. When this is all over, he needs to be recalled. The Republicans and the Democrat who traded stock based on insider information on a briefing, those people need to be recalled and moved from office. And when we come out of this, we're going to find out two things, I think. One of them is that a number of our politicians are useless, and other ones of them have been effective. And the ones that have been effective, we should celebrate no matter what party they're in, and the ones that have not been need to be recalled and removed of either party. And I think the final takeaway from this is that the reporting of the press has been catastrophically awful in every way, in every single way. And and if anything is an indication that we no longer need the mainstream news media, which is we started doing this in 2003 when I started writing Eject, Eject, Eject was something that was just on the horizon. Now I think without question they are the least reliable source of news out there. And the entire purpose of this CoronaSphere Lounge is to present hopeful data that appears to withstand the fundamental scrutiny of reasonable people. And if it turns out that there's something that I've missed or made a mistake on, I'm certainly happy to retract it right away. I've done that before. Anyway, good news to share with your friends, and sharing with your friends is important. We don't make any money on these videos through advertising. It's not playing the world's smallest violin here. I'm just trying to praise you of our production situation. We have me, Scott Ott, Steve Green, both remote co-hosts. We have an editor and we have an office manager. And we've gone from 11 shows a week to 18 shows a week. The additional shows are not allowed to be monetized on YouTube. That ad revenue is continually being choked off. These programs are made possible by a few people who step up and become members of BillWhittle.com. They're paying for the content that they're receiving, and furthermore, they're paying for content that numbers of people, huge numbers of people, have received and not paid for because they think it's important. In any event, if you'd like to be one of those people, you can go to BillWhittle.com and click on the Become a Member link. We've had a number of people step up during this crisis. We're very grateful for them, and we're extremely grateful, endlessly grateful, for our long-term members who have been with us from the very beginning. So we'll have some more good news tomorrow, I think. Some interesting, very interesting, promising stuff in terms of vaccines and quick application of vaccines. And then somewhere in here, as data continues to come out, we're going to have a conversation about China. Let me just add this now, but let me simply say this. If it turns out, as certainly seems to be the case, that China has in excess of 40,000 dead, and they're reporting 3,000 dead, and China was hyping a week ago that they're reopening lockdown and reopening entire counties, districts, because the virus is over. If it turns out, and it's looking almost certainly like that's the case, if it turns out that that is in fact the case, then what they have done is gone from incompetence to criminal negligence to full-on absolute fraud, and that fraud is killing people all around the world, and it's empowering people like Hillary Clinton and Marcos from Daily Cause to convince Americans that somehow our political system, and I'm talking about the president, I'm talking about the entire political structure, is so incompetent that the whole thing needs to be just basically trashed. It's absolutely not true. And when you take the Chinese casualties and you take American casualties, when this thing's all said and done, when you have a look at these two numbers, you look at the fatality per million population, you will not believe the difference. You will simply not believe it. It'll be the end of socialism as a political system, and that number is going to show up all around the world. Anyway, thank you all very much for being here. It's always a great pleasure to talk with you, and I learned so much from the comment sections. Thank you for your continued support, and we will see you tomorrow, the 5th of April, Sunday, right here on the CoronaSphere Lounge. Take care. Be careful. We'll see you soon. It's working.